Working with patients with severe anxiety is challenging. In the following situation, the patient is able to carry on a conversation in spite of her pacing. However, some patients may not have the ability to converse and may instead wring their hands or possibly hyperventilate. Nurses need to be aware of signs and symptoms of hyperventilation and be prepared to assist the patient with slowing their breathing down or possibly rebreathing into a paper bag. Some patients have developed an understanding of their panic attacks and anxiety. Others may not be able to identify their triggers. The young woman in the situation has an awareness of triggers and removed herself from anxiety-causing situation. However, her anxiety is not reduced completely. Equally important is the response of the family and the strangers. This woman avoided an altercation with law enforcement officers due to the quick action of her fiancé, who realized where she had gone and came to the car in the parking lot of the shopping mall. Other patients may be admitted due to altercations with the police or strangers who attempt to calm the situation or calm the anxious person using methods that are not effective. This may result in escalating behaviors that result to injury to the patient or others. Patients who are anxious and pacing may be impulsive. Nurses need to allow extra personal space for physical acting out. The nurse in the scene appropriately gives this patient adequate space to feel safe but not encumbered. In this situation, the nurse focuses on establishing rapport and helping the patient feel safe. Notice the calm voice and the body posture of the nurse. Note, the nurse positions herself so that she is able to leave the room safely if the patient begins to physically act out.
Knock, knock. Hi, Paula. My name is Savina. I'll be your nurse today. Okay? I've been a nurse for about 10 years. I'm just going to go ahead and start interviewing you today. I'll be asking you, what brought you in and stuff like that. But I'd like to thank you for coming in. We really appreciate it. So can you, do you need anything?
No, I'm fine.
Okay. Can you tell me what brought you in today?
Well, I was at the mall with my fiance, and I just had one of my nervous spells.
Okay, and what do you mean by a nervous spell?
We were shopping,
okay.
and I got this overwhelming feeling, like a tightness in my chest,
okay.
And I used to think maybe it was a heart attack, but okay. I've been dealing with this my whole life. I know that's not it.
Well, sometimes anxiety can be so severe that it causes palpitations, which is just when your heart beats really, really fast. Would you say that you're having some pretty severe anxiety today?
Yeah, I guess you could call it that.
Okay. And what else was your family doing today? Did something trigger it, or was it just in general?
Well, I guess it's just general. I mean, I don't like busy crowds, especially during the holiday season, Today it just became too much and I couldn't handle it, and I know myself well enough that I just had to get out of there. And I can't believe someone called the police just because I was sitting in my car in the mall parking lot, and I was crying and banging on the dash, and oh, thank God, my fiance thought I might be out in the car, and he came out before the police got me in the squad car. I mean, I could be in jail right now. I just don't know.
Okay.
I just totally blanked out.
Well, I can see you're trembling a lot right now, and the charge nurse is receiving orders from the doctor. One of those orders happens to be medication. I think it would really help if that's something you're open to. We'd be happy to help you if you're open to it.
My fiance is convinced. I really want this relationship to work. I was married once before for like 3 months, and because I don't like to go out, it messed up our social life. I mean, we couldn't go on dates with other people. But that's another story.
It sounds like that loss of relationship still is pretty painful to you.
I try not to think about it.
Okay. And would you say you were lightheaded or faint at all today?
Well, I guess I did get a little bit lightheaded when I was dashing from the store, but nothing to write home about. I just my fiance was really mad at me that I didn't tell him where I was going, and I just need help to make sure this relationship works out.
And how long have you been engaged?
Well, we've been dating for like 3 months, but we just got engaged last week, and
Okay, well, congratulations. You know, that is a big change. Are you worried, would you say, about the wedding or meeting his family?
all of that stuff is super worrisome. I mean, don't get me wrong. I've got a really good job as an insurance salesperson, but it's not like I'm rich. I just we have to pay for the wedding on our own, and I don't want to let him down.
Okay, well, it sounds like finances are a bit of a stressor for you. Would that be a fair statement?
Yes.
Okay. Well, you know, medication could really help you gain control when you feel like you're losing it. You know, we
It'll
can.
make my fiance happy. This is what he wants.
And what do you mean that will make him happy?
Well, it's just that he's been trying to get me to talk to someone who can prescribe medication for a while now, but I was on Xanax before, and I didn't like the effects.
Well, you know, there are lots of medications out there. You know, don't just cut them all out just because you know.
I like to be my own person. I like to be in control of myself.
Okay. Well, you know, medication can help you in incidents when you feel like you are losing control. You know, it's just something to think about.
Well, I tried your stupid benzos. Why don't you take them?
Okay.
I'm sorry. I'm super stressed.
No, I understand. You know, Paula. We do have to ask though. Are you on any, you know, street medication like marijuana or K2 or meth?
No, you are just making me more anxious. Why does this have to happen to me?
Okay, Paula. We will go ahead and get you that additional admission information. I can get a handout for you. You are in a safe place, Paula. You can go ahead and take a little break, and then I can fill out the rest of your admission information later.
I just need some space, for Christ's sake.
Okay, alrighty. We'll go ahead and get out of your way. Put on the call light if you need anything, and we'll be in touch. Thank you, Paula.
Safety for both the patient and the nurse are primary concerns when working with patients with extreme anxiety. Personal space, at a safe distance, should be maintained at all times. The nurse in this situation made an attempt to assess if the patient had ingested street drugs that might contribute to the anxiety. What other assessments or resources could the nurse use to determine if the patient's anxiety was exacerbated by the ingestion of street drugs? Persons with high levels of anxiety may become claustrophobic. What actions should the nurse take to reduce overstimulation for this patient? The patient reacts negatively to the idea of taking a medication. How did this nurse react? What other approaches could this nurse use? Think about the fluid and caloric needs of a patient who has been pacing for long periods of time. How might the nurse encourage the patient to eat and drink? How did the nurse approach in this scene compared with your expectations based upon the reading about the care of patients with panic attacks and anxiety?